through our weekly surveillance report. Tracy, Ellig, and Kelly Kujawa are with us. Tracy's from MSU and Kallie's from Bozeman Health. We also have with us today Lander Cooney from Community Health Partners. As we speak at the fairgrounds, our pod facility is being used by Community Health Partners to deliver vaccines to some of their patients and some others in the community, and she'll want to talk a little bit about that. And then we'll all be available to take any questions that y'all might have. You'll see that all right? Hear me okay?
Yep, we're good.
Okay, so we continue to see an increase in daily case numbers. The 7-day rolling average was up to just a little over 35 cases per 100,000 per day. As of yesterday, that's another increase from where we were last week, which was an increase from the week before. We continue to be above that 25 cases per 100,000 per day, which is that Harvard University threshold for spread that really causes concern where we are. Again, compared to where we were in November, significantly below that, but concerning, especially when you couple it with the positivity rate has gone over 10% again, gone up pretty significantly. So this is not about an increase in testing. This is about more of the tests we're running are coming up positive. We're now above that 10% threshold. There's been for some reason or another, a little bit of a lag in the test results coming out of Big Sky. So this is without some of the Big Sky testing. We are getting positive test results out of Big Sky. We're working through those. Just want to let you know, usually I'm giving you both numbers. This is without Big Sky tests in it for the past about a week now. So, we're seeing overall a rising positivity rate. That might come down a little bit with the Big Sky testing, but I wouldn't expect it to change the trend. We're seeing rising case numbers and rising positivity. Both those things are concerning. Good news is our test collection and the rate that with which the specimens are being run through labs and returned to us remains good. The median time continues to be a day. That's encouraging, and you can see we're able to get those within a day, and sometimes less than that. We're able to turn around and start our investigation generally the same day we're getting the test result, unless it comes in late in the day, and then it would be the next day in some cases. You can see the epi curve for onset date of symptoms for people who are reported as cases. And here you can see the age breakdown, and you can see what we've talked about in the past. The uptick in the 20-something age category is really driving the overall uptick. We're seeing a little bit of an increase in other areas, but you can really see it's pretty pronounced how many of these new cases are being identified in people in their 20s. The concerning thing about that is in the past, nationally, regionally, statewide, this tends to spread to other age categories. Now, what we don't know right now is the impact of the vaccines and what the impact of the vaccines are going to be on that spread into those other age categories. And I'll talk a little bit more about that in a minute. MSU, we're continuing to see, again, a gradual increase in the number of new cases reported. We were up to 46 new cases in the last period, 43 active cases. Those are both increases over the previous reporting period. I would continue to say that this is not just an MSU issue. We're seeing cases on campus, off campus, MSU, non-MSU, in that younger age category. And then still seeing cases in schools, and our hospital capacity has been in pretty good shape. The really good news is we continue to see low single digits. I think we had 4 or 5 people in the hospital the last couple of days with COVID. That's good. We want to keep it there, and we're hoping that the the number of vaccines we've been giving will help with that. We have, just to give you a sense of that, we've given out countywide about 26,500 people have received at least a first dose. Nearly half of those folks are over the age of 60. A total of over 41,500 doses administered. It's looking like we've got about people in their 80s or older. About 83% of them have gotten a shot at this point in time. And people who are in their 70s, about 64% of them have gotten a shot in Gallatin County, and then about 50% of people in their 60s. That's really encouraging. We're continuing to focus on that age group, because we know that as we see those increases in numbers, the younger age groups, that tends to migrate through the age spectrum. We're hoping that the vaccines can help us slow that down. But we still have a significant number of people out there. Only about 28% of our eligible population has gotten a shot at this point in time. So we still have people who are significantly at risk, and we still have a number of people who have not had a chance at the vaccine. So we're going to continue to work hard on that. I would say we've also seen an increase in our overall vaccine supply the last couple of weeks. The last couple of weeks, our state allocation has been over 4,500. That's really good. And we've gotten to the point now where we're really looking for places to be able to help us administer that vaccine. And the other thing I want to really emphasize this week, we started a new system for vaccine sign up on the healthygallatin.org website. It allows people to go in there, give us what we're calling a notice of intent to vaccinate, notice of interest. You can go on that website, give us your information, tell us how old you are, tell us whether you have underlying health conditions. We are going to be prioritizing those people who are in the 1B plus phase eligibility. As of earlier today, I think we had just under 8,700 people had signed up on that waiting list. That's a significant number, but we're clicking through thousands of new vaccines every week. So when you really think about that in the grand scheme of things, we're not too far away from being able to offer vaccine to those folks. We want people who want a vaccine to go and sign up on that website. That will help us plan. It helps us understand how much vaccine we need. It helps us invite people to those points of dispensing. As we have partners like Bozeman Health and MSU and others who are doing vaccine pods, and they have slots available, it helps us identify people who are interested and direct them to those points of dispensing. So healthygallatin.org, it's still available. It's going to remain available. Once you sign up and we have slots available, we're going to be sending out an email and a phone message, an automated phone message to let people know that they have that email. And then you can go in and you can choose an appointment date. What we're hoping that does is it really reduces the number of people who are hitting that system all at once, and it takes some of the time pressure off of it. We do need people when they sign up to continue to monitor their email, to continue to be responsive. We're going to give people 24 hours to sign up, and then we're going to move on to another batch of people because we want to get that vaccine out there as soon as possible. It doesn't mean you've lost your chance altogether, but we really need people to sign up within 24 hours when we tell them there's a slot available. And again, you won't have to go get your vaccine in 24 hours. You're just going to have to sign up for an appointment probably the next week. So again, healthygallatin.org, we want people to go out and let us know that they're interested. It helps us connect who's interested in the vaccine with supply and with people who are able to administer it. With that, I'm going to throw it to our partners. Kallie, I'm going to start with you today. Do you have anything you want to add to what I've talked about?
I do, yeah. Thanks, Matt. So to date at Bozeman Health, we've administered over 8,000 first doses and over 7,000 second doses to our patients. We're really excited to be able to triple the amount of vaccines we're administering, and that will start on Monday, April 5th. We have enough vaccine at this point that every week at Deaconess Hospital for the month of April, we'll be able to immunize 3,000 individuals a week. We've sent out emails to more than 10,000 of our patients this week already. And we've also added the vaccine sign up link to our website. And that website link is bozemanhealth.org/vaccine. We've also emailed all Big Sky Medical Center patients with links to sign up for appointments at Big Sky Medical Center on April 6th and April 8th. And then in partnership with Gallatin City County Health Department, we've also emailed 1,000 individuals from their waiting list as well, inviting them to sign up for an appointment with us. We'll continue to reach out to our patients as we receive more vaccine, and we really encourage folks to check their spam folders to make sure that they're seeing their emails from us. And we will continue contacting patients, but like I said, we definitely want them to be regularly checking our website, looking at our Facebook and Instagram if they are on social media for additional information. And like you said, Matt, it's very helpful now that we have the ability for people to go to our website and sign up for one of the 12 clinics that we have listed now. We really, really are urging people to get scheduled for their vaccine appointment as soon as they're able to. So that's all that I have at this point in time. I think you covered our bed capacity, which as of today, we have 65% of our critical care beds occupied and 65% of our non-critical care beds occupied as well. So bed capacity wise, we're doing pretty well. But thank you.
Thanks, Kelly. Tracy, do you have an MSU update or not?
Just a quick summary. To date, we've vaccinated 2,000 students, faculty, and staff. We've got roughly 600 students in the queue who will get their second dose before May 1st. And just as a reminder, May 1st is the end of this semester, which is coming up fast. Thanks.
Thanks, Tracy. Lander, I know your organization's been busy this week. What do you have to tell us?
Thanks, Matt. I don't have a whole lot to add. CHB, we continue to work hard with our partners and county health departments, both in Park and Gallatin counties, to deliver vaccine as efficiently, as effectively as possible, both to our patients and to vulnerable members of our community. So we're doing that both through in-clinic vaccination and also pods at the health departments or out in the community with partners like HRDC. We were at the Warming Center yesterday. So we'll keep doing that work and working together with you all to get as many vaccines out there as possible. Thanks a lot.
Thanks, Lander. Okay, we can open it up to questions. Are there any questions out there?
Yeah, this is Aaron Bolton with Montana Public Radio. You mentioned the vaccination rate. Is there an overarching goal for the county at this point to reach herd immunity, or are there still questions to be answered on like what actual herd immunity looks like with this vaccine?
Well, the long-term goal is absolutely to reach herd immunity. The really more near-term, short-term, immediate goal is to get vaccine to everybody who wants it. We really want to make sure that we're making it available, especially in those older age populations, people with underlying health conditions. Aaron, once we start seeing where the demand slacks off a little bit and we're satisfying that demand, then we'll really start to think about how to go outreach to those populations that haven't yet gotten their shot. But the near medium term goal is to just make vaccine available to everybody who really wants it right now. After that, we'll go after herd immunity.
Is there, I guess my question, is there a percentage goal that represents herd immunity?
I would defer to, the sort of the percentages that you hear from the CDC. If you're getting, 60, 70, even 75, 80% of people, you want to have some level of immunity. You have to factor in that natural immunity that some people are acquiring by having the disease. So we're not close to herd immunity yet in terms of the number of people we've vaccinated. But this is a new virus. This is a new vaccine. We'll have to see how that goes, and we'll take our guidance from the state health department. Our real focus isn't on any big percentage for herd immunity. Our real focus is making our vaccine clinics run really well to get as many people through as we can. Other questions?
Matt, it's Noah Schmick, ABC Fox Montana. I was wondering, is the current uptick right now, is it just 20 to 29? Like, is that kind of what we're seeing?
Well, that's what's driving it. I mean, I looked last week and we had a little bit more specific breakdown in terms of age category. And I think, as I recall, something like 60% of our new cases were between the ages of 20 and 40. So if you really took those cases out or normalized them to the rest of the population, I think you'd see a significant flattening of the curve there. So it's significant. We're also seeing out there, we're going to be responding to some complaints we've gotten. Some of the bars, things seem to be picking up. We're seeing a little bit, maybe less structure in one or two places, and we're going to be communicating on that in the days ahead. Weather's warming up and people are coming together. It's concerning. The Board of Health is meeting on Monday. They're going to be considering all 4 emergency rules. They have a resolution to rescind and a resolution to extend on all of them. I would just say to the community that to the extent that we can bear down now, it makes those decisions a lot more easy for the Board of Health. It's a pretty difficult decision right now with our case numbers going up, our positivity rate going up. We're getting calls from the CDC director to really bear down and not take down things like the mask mandate. At the same time, we're getting pressure from the legislature in the opposite direction. So the board has some difficult decisions ahead. What I would just say to the community is, to the extent that we can continue that social distancing, continue using those face coverings, really finish strong through this spring will be the extent to which we have a chance at a more normal summer. We really need people's help. We're not done with this yet. You can look at what's happening in Brazil, look at what's happening in some other places with the variant strains. That's pretty concerning. Not saying that's going to happen here, but with case numbers coming up, that's a concern. Other questions?
Hey, Matt, it's Nora Shelley with the Chronicle.
Hi, Nora.
Hello. I'm wondering about the variants. Do you have any updates on testing or any new variants in the county?
I know we've detected a number of cases with the UK variant, and I know that there were some variants of concern. I would refer those questions to the state health department, and I'm going to be checking in on that myself later on this afternoon. You reminded me that I haven't checked on that in a while. Overall, though, what I would say to people is, don't be shocked that those variants are here. They're spreading through the U.S. We should assume that we're dealing with variant strains of the virus, and we should continue to be careful with how we're conducting ourselves, wearing those face coverings, keeping that social distancing, and getting your shot when one's available.
Gotcha. Okay. And I'm wondering, it seems like the number, I mean, obviously you mentioned the number of doses that Gallatin County is getting has increased. And I guess I'm wondering if you expected that, and if you expect that to continue, and kind of what that means for the county.
We haven't gotten, the state is really facing a challenging situation too, because they don't know exactly how much vaccine they're going to be getting from the federal level. And so I know they're doing their best to give us sort of forecastable numbers. What I'm sensing, I haven't been told, we haven't gotten any really specific numbers. What I'm sensing is that supplies are picking up kind of nationwide. We're hearing that from the president and the CDC. We're hearing the governor talk about that. We're expecting, and we are seeing increases. Nobody can guarantee that. We saw what happened with the Johnson & Johnson facility back east, and some of the doses not being able to be used. So, everything is kind of on the table right now, but we are preparing for continued increases in the number of doses because we want to be ready to give them out when and if we get them. We're getting to the point where we have as much vaccine as we can give out. We are working with as many partners as we can. We're getting it out there as much as we can. But that's good news. I can't tell you for sure what we're going to be getting in the weeks ahead, though. We haven't been given specific numbers. I'm optimistic about it, though, put it that way.
Okay, thank you. And the last thing, and this I guess could be for anyone, but I guess I'm wondering at this point in time with the vaccine rollout, like what groups of people in Gallatin County are you concerned that might be being missed for whatever reason with this?
What groups are we concerned what?
Are being missed, I guess, in the vaccine rollout?
Well, I'll just start. We're really focused. We want to make sure that the people, anybody who falls into that 1B plus population, they've been waiting. Those folks have been waiting. We're going to continue to prioritize them. I'm concerned about people who are out there who may not have access to the internet, may not have access, may not be as mobile or as tech savvy. Those folks we've been concerned about. We're concerned about populations that are at higher risk, people of color, American Indians who really have significantly higher rates of serious illness and mortality, and not just nationwide, but in Montana. So it's the same groups that we've been concerned about since the beginning. Maybe Lander can talk about some of the work that they've been doing with HRDC this week to get to some of those populations too.
Sure, I'll just echo what Matt was saying about the vulnerable populations that we're attempting to focus on. At CHP, our in-clinic vaccinations, about 13% of those have gone to patients who belong to a racial or ethnic minority group. And so we're particularly focused on that group because of the high-risk nature. And some of that looks like making sure that we have Spanish interpreters at any of our pod activities that are large scale, or that we make sure that we have access for folks who have limited English proficiency to all those services. And then I think the other opportunity is working with partners. We've been focused on some efforts with HRDC to make sure that we're providing access to vaccination for our folks facing homelessness in our community. And that's a population that we are noticing has some degree of hesitancy, as well as facing barriers to accessing points of distribution or other ways that traditionally you can get a vaccine. So I think some challenges ahead, but they aren't insurmountable, particularly because of the way partnerships tend to work in this community. So we'll keep working together to make sure there's access to everyone that needs it.
Kallie and Tracy, do you have anything to add to that?
Yeah, I could add that, we're at an advantage with our electronic health record, much like CHP. We have a lot of demographic information on our patient population. So we do know which patients perhaps will require more assistance with scheduling. And so we do have a call center of nurses who are reaching out to those patients and getting them scheduled. We also have a group of home nurses who have been previously going to patients' homes. And if they were already established patients, then we were taking vaccine to them. So we have done that in a number of different ways to get the vaccine to those who may be challenged with our current clinic situation.
I'd just say that the way our vaccines have broken down to date is probably 75% of them went to 1A or 1B, and the last 25% has probably been mostly 1B plus, because we've been able to access student health records as well.
Thanks, guys. The other thing I would say, you reminded me, one population of concern that has kind of come up over the past week or two. We've had some cases in older populations who are served by home health care agencies. We've also had some experience with some of those home health care agencies where workers aren't always wearing masks when they're going in and having those interactions with their patients in those homes. I would really urge families that have people who are getting services, especially older folks who are getting services from home health care or any other place, to really do everything you can to ask those home health agencies to use face coverings when they go in, and to find out if those agencies are going to be providing the vaccine and find ways that those folks can get the vaccine. That's really concerning to us. It's a gray area as to whether somebody going into a home setting is required to wear a mask. We're hearing that that's not always happening. We're hearing that in some cases, there's in a small number of cases, there's some good reason for that. There can be with people who are going through dementia, people who are struggling with their mental faculties, that can be disturbing. But we really need to see those workers wearing a mask when they do go into those facilities, and we really want to see those workers getting vaccinated as well. And we're not seeing universal uptake. We're seeing pretty good rates in some facilities and not so great rates in other facilities. And so I would say to families out there who have a loved one in a nursing home, in an assisted living center, who are using that home healthcare agencies, ask those questions. Are those people wearing masks? Are those people getting vaccinated? Because it really matters, and it can be a risky thing to have a home healthcare worker who's going from one home to the next who may be carrying the virus and not even know it. So that's come up significantly over the past week or two. And I think it's important that families understand that and that they advocate for the people who are in their care. Other questions?
This is Aaron Bolton again with MTPR. I wanted to follow up on homeless populations. Whoever might want to talk about this a little bit more, but are there specific efforts to get out to homeless shelters or homeless camps and try to build some trust there and get some vaccines into those populations?
Lander, I think that's all you.
Sure, thanks. Until yesterday, CHP and HRDC were working together with the health department to make sure that some of the scheduling activities to pods that were provided together were accessible by HRDC to go ahead and schedule some of their customers that they have relationships with. Yesterday, CHP staff were on site at the warming center actually to deliver vaccine. And I think that it was our first effort there. I'm sure we learned a lot, and we will be working on tailoring that effort to the sort of the next phase as we move into warmer weather. We'll probably need some different approaches to make sure we reach that population.
And the other thing I would say is we'll continue to make slots available and make vaccine available to HRDC and our other partners who serve those populations. It's a good way to use some of the Johnson & Johnson vaccine with some of those populations where you only need one dose. Use that Johnson & Johnson vaccine if we're not sure we're going to be able to get those folks to come in for that second dose. So we're really trying to do it in a variety of ways, both by making slots available and then actually taking the vaccine into places like the warming center where there's an opportunity to give people shots. Other questions?
Hey, Matt, I figured save it towards the end because I know we were answering more pertinent, timely, daily stuff. But just talking real quick, because I just caught your announcement. I was off earlier this week, but I caught your announcement on your new gig and the promotion, just kind of going into that a little bit. I'm calling it that, but just in terms of Gallatin County and moving forward, what's on the mind?
Well, I thought I was going to get out of this without maybe being asked about it. It's been a tough week. I mean, I'll tell you, I'm really excited about the new job. I am, but it's hard to think about it right now because we have a lot of work to do. I'm 100% health officer here for the next couple of months as we continue to roll out vaccines. I've gotten a lot of questions. I've had people come up to me and say it'll be a relief to leave, and it really won't. I love this job. I love my team, and walking away from this work at the health department is going to be really tough. I will say, and the year has been difficult. I mean, my motives have been questioned. My intentions have been doubted. Same with the people I work with. I've been insulted in front of my kids. I've had protesters in front of my house. But as troublesome as those things are, I never even thought about quitting. And that is in large part because of the overwhelming support and good wishes that I got from the community. that kept me going. The community kept me going. My staff kept me going, and I can never express enough gratitude to the community. And that's why it's so good that I get to stay here and continue to work in public health. This community supported me, has supported my family, and has supported our team. I'm not leaving because this job is hard or because a small number of loud people are nasty and disrespectful. In fact, that made me more determined. And it's also one of the reasons that I think my next job is so important, because I'm not the only one that's been experienced that behavior that's uncivil and unkind. Many of my colleagues all over the state have done that. It's been a hell of a year for public health, and we have a lot of work to do to find the path forward and, find a new way to continue to do what we all really are passionate about. I love this community. I love the state. I know that the vast majority of people here, almost everybody is, even those who disagree, are kind, they're respectful, and they care for their neighbors. That's the Montana way. That's what's kept me going, and that's what makes me excited about the new job. But right now, there's a time and place that I'm going to want to talk more about the new job. Right now, I'm 100% health officer. I'm here working every day to get vaccines out, to pursue cases, get people isolated, and we have shots to give and the virus to fight. So that's where my focus is right now.
That's what I figured. I just figured be the one to throw that one at you.
Thanks.
You got it.
You weren't. I was going to. How much of a role are you going to play in that new health officer, though? I know we've got a few months, but how much a role will you play in getting someone else?
Well, I'm going to do everything I can to serve the board, to serve the county commission, and to serve the city commission. Under Montana state law, it's up to the Board of Health to select the health officer. And so they're going to be going through that process. I'm their servant in that. I am doing my best to find them a good slate of candidates. It's really important to me. I won't have a lot of say in who that is. My job is to really do everything I can to give them some good choices, and that's what my role is going to be.
Perfect. Thank you.
Thank you. I'm good too.
Other questions? All right. I wish you all a wonderful Friday. Get out and enjoy the weather in a great socially distanced way, and have a great day.
Thank you, Matt. Thank you, all of them, everybody.